Okay, so hi Dylan, my name is Hannah. I'll be working with you today. What seems to be the problem?
Yeah, so I was playing softball. I mean, I've been playing softball on the weekends and just over like the past few weeks, it's just my shoulder's been hurting, like throwing. It's just been kind of getting worse over the past few weeks, and I just kind of wanted to come in and just see what the issue was because it just feels like it's kind of affecting my playing each weekend, and it's just painful. I don't want to deal with it anymore.
Totally understandable. Where is your pain, if you don't mind me asking? Like any
Um,
specific part of the shoulder?
Yeah, so it's kind of more like in the back area,
Hmm.
um, kind of kind of in right in the back of the shoulder, and then kind of a little bit um into the back, just a little bit.
Okay.
So
I believe you said it happened over like the past couple of weeks, right?
yeah, I started noticing it like about 3 weeks ago. It wasn't bad really at all. But then like as we played more too, it started getting more aggravated, and um, yeah, it's just kind of just been like a achy pain for a while. So
Okay. Thank you for letting me know what type of pain it is. That's super helpful. If you had to rate your pain on a scale from 1 to 10, 1 being no pain, 10 being take me to the hospital right now, what would you say your pain is?
I say like uh, right now it's like a two. It's not bad at all. Like
Okay.
I'm fine just sitting here. So
How is it when you're moving?
when I'm active, I'd say it's like a four or a five. Like it's noticeable. It's not like I would have to go to the hospital for it, but like it's pretty. It's apparent. It's annoying.
Okay.
So
Is there anything you do that makes it better? Like, so do you ice it or like take
I
um,
yeah, some ice
Aleve or
helped after the
something?
games.
Okay.
Yeah, so kind of relieves some of the pain.
Okay. Do you take any medication for it or no?
No, I haven't tried any medication. Just tried the icing. So
Okay. Do you have any weird symptoms like numbness or tingling down your arm or anything like that?
I haven't noticed that. No.
Okay. And what seems to make it worse?
Throwing is pretty much the big thing. Yeah. I notice it a lot. Like way up at the top, and then I notice it kind of like in the follow through. Kind of towards the end, it hurts a lot. So.
Would you say your pain is only when you're throwing, or do you have issues during your everyday life too?
It's not too like I have a desk job, so it's not too bad. I don't
Okay.
really notice it. It's more definitely more on the weekends and stuff.
Okay.
When I'm doing it's mostly when I'm throwing. So
Okay. Have you had any injuries on, this side before or your upper extremity or anything like that?
no previous history of it.
Okay. Does your arm feel like loose in any way?
No, it doesn't feel loose.
Okay. Have you noticed any types of weird sounds? So like clunking, grinding, or any weird sensations like that?
Not that I've noticed. No.
No?
Mm-mm.
Um, when you throw, do you notice any type of like sounds or anything, or is that just like none like before?
No sounds. It's just painful.
Okay.
Yeah.
So from there, like I just want to ask because I can't really see your shoulder right now. Have you
Yeah.
noticed any like bruising or swelling or anything out of the ordinary?
Yeah. No signs of like any like bruising or swelling or redness. It's a little tender, like in the
Mm-hmm.
back of the shoulder, and kind of over the like my scap a little bit. Um,
Okay.
but otherwise, yeah, no like deformities or bruising or anything like that.
Okay. Perfect. Um, so if you're good with it, I would like you to do some self palpation. So you're
Okay.
gonna take your own hand, and first I just want you to find like your clavicle up here, and I just want you to walk your fingers like along the clavicle. Any tenderness in your clavicle in that bone right there? No.
No,
Then we get out to like this more solid point, which is your AC joint. Do you feel anything in there?
nothing out there.
No.
Nope.
Okay, I just want you to walk your fingers downward into like this meaty part of your arm right here. Anything in there?
Not really. Not too bad.
No? A little bit or just not at all?
Like I can feel it starting when it's like towards the back, but it's not too bad like in like where you told me to push. So
Okay. Can I have you walk your fingers up a little bit from there? So now we're
yeah.
looking for like the head of your bone up here, which is called the humerus. Do you
Mhm.
feel like any pain in that joint line right there?
Nothing there.
Okay. If I have you walk your fingers more towards the back of your shoulder,
Yeah, that's like a little tender back
a little
there.
bit?
Yeah.
Okay. If so, while you're back there, you might run into like a bone that looks like it goes like straight across. That's
Mhm.
the spine of your scapula. Do you feel anything when you're poking on there?
No.
No? I'm gonna have you take your fingers and just go a little bit above that. So there should be like a little bit of muscle above that.
Okay.
Any pain in there?
No.
No? So drop back down to your spine of your scapula for me. And then drop a little bit below that.
Okay.
Pain in there?
It's like a little bit.
A little bit?
Yeah.
Okay. And then I'm gonna have you walk your fingers just a little bit outward. So you're like by your armpit underneath here.
Okay.
Do you feel anything like back there when you go underneath?
No, not too bad.
No?
It's a little tender.
A
Yeah.
little bit?
Hmm.
Okay.
Sorry, I'm trying to think of like anatomy, like where everything is supposed to be.
Oh, don't worry about it.
Um, yeah, I don't think it's too bad.
Okay. And try to do like the same thing. I don't know if it's too far of a reach for you to just like try to get in that same area, just like
Hmm.
a little bit above.
Are you saying like
Yeah, probably
kind
about
of?
like right in there. I don't know if you can,
Yeah, it's hard to show it.
yeah, testing my flexibility a little bit. So like spine of
Yeah,
the scapula, drop down, and then maybe a little bit outwards towards your arm.
yeah. Yeah, it's a little tender.
A little bit? Okay.
Yeah.
I'm just gonna have you walk your fingers down more towards like your triceps area.
That's fine down there.
Fine, all the way down, just making
Mhm.
sure.
Yep,
Okay, perfect. I'm just gonna have
that's
you
good.
walk. Perfect. I'm just gonna have you walk your fingers up one more time. So find that little tip of your shoulder. You're gonna come down and you're gonna keep pressing until you feel like a little bit of a bump.
Hmm.
But you have to push a little deep for that. Do you have any pain in there?
No,
No? Okay. And then we're just looking for like a little tendon that you can cross over. You can do a little bump. Anything in there?
nothing in there.
Okay, perfect. So one thing I've been like, I kind of realized I didn't ask you before. When you put your arm up, like you're throwing, like does that
Hmm.
motion just hurt like that? So like the 90 and then 90?
Um, yeah, it's really like when I like on that swing, like when I cock it back,
Okay,
it hurts. So
okay. Does it hurt anywhere else throughout your throwing phase, or is it just when you swing it back?
it's that, and then like after I release and do the follow through,
Okay.
um, it hurts during that.
Do you feel like you lose any type of velocity, or like do you feel like it's weak?
Yeah, I feel like it's been weaker. Yeah.
Okay. So next we're gonna go through range of motion, and since I can't really do passive range of motion on you, we're just gonna have you do the motions, okay?
Okay.
So you can sit down or stand up for it, whatever you're comfortable with.
Okay.
If you just want to stay sitting, that's probably fine.
Okay.
So what I'm gonna have you do is I'm gonna have you put your arms straight. So we're gonna start from the bottom, and we're
Okay.
gonna
Yeah.
move our arms upwards as far as we can over our head. Pain with that?
That's okay.
That's good. Okay, you can put them down. Next, well, you might have to stand up for this one, or you could just
That's
tell
fine.
me if it's painful or not. Just
Well,
like
here, I'll adjust.
okay,
Okay. I gotta okay.
perfect. So you're just
It's hard because I'm tall, so the camera's like all wonky.
oh, that's totally okay. So you're just gonna take your arms and keep them straight, and you're gonna move them backwards, so like the opposite of we did before.
Okay.
Pain with that?
That's okay.
That's fine. Okay,
Mhm.
you can sit back down for the rest of them if you'd like.
Okay.
Thank you for moving the camera. I appreciate
Yeah.
that. So for the next one, we're gonna have you keep your arms straight at your sides, and you're just gonna bring them straight up as far as you can. Pain?
That's okay.
That's fine. Okay. And then I'm going to have you take one arm at a time, so you can pick whichever arm. You're
Okay.
going to take one hand and you're just going to bring it across your body as far as you can. How's
That's
that?
okay.
That's okay?
Mhm.
All right, perfect. Same thing on this side. You're going to bring it across your body.
And that one's okay too.
Okay, perfect. And then we're going to have you bring your arm up to that 90-90 position, whichever one you'd like first.
Okay.
This one might be a little bit painful, so just let me know when or if you feel pain. So I'm going to have you take your hand and kind of move it backwards.
Yeah, that's painful.
That's painful? Okay, you
Mhm.
can relax. Or sorry, not relax, bring it back to the test
Take it
position.
back. Okay.
And then move it like inwards or down.
That one's okay.
That one's okay?
Yeah.
Okay, perfect. So you really only had pain with this one, right? Your external rotation?
Yeah.
Yeah? And that's basically the position that you have when you throw, right?
Yeah. Yeah. I feel it a lot there.
Okay. Since we can't really do a lot of special tests or manual muscle testing, I want to try something a little bit creative.
Okay.
So for the manual muscle testing, I want to try to test your internal and external rotators. So
Okay.
I don't know if you can see me, but you're
Yep.
gonna take your hand and you're gonna kind of put it like down by your chest or like your where your ribs go.
Mhm.
I want you to like push on it. So like push it towards your stomach and then
Mhm.
try to like turn your arm outwards like that. But
So
don't.
like this.
Yeah, so try to move it like that, but
Okay.
try not to let yourself do that if that makes sense.
Yeah. Yeah.
Okay, so whenever you're ready, you can do that.
Yeah. I mean, that's a little painful.
A little bit?
Yeah.
Okay. And then we're going to do the same thing. So instead of pushing outwards, I want you to take your hand, push it, like move it towards the inside.
Okay.
And then you're going to do basically the opposite motion.
Okay.
So whenever you're ready, you can do that.
Okay. That one's fine.
That
Yeah.
one's fine?
Mhm.
Okay. Perfect. So I feel like the only special test that I could really do at the moment would be probably Gerber's lift off. If you could, yeah. So just put it on your back.
Okay. Yeah.
I'd probably have you lie down, but for the sake of like evaluation.
That's fine.
Can you lift it off your back? Is there pain with that?
That one's fine. Yeah.
That one's fine?
Yep.
Okay. Is there anything else that you think would be helpful that I haven't asked that you want to like tell me?
Let's see. Have you guys done the internal external rotation leg tests?
I don't think so.
I was gonna say because that one's usually my big giveaway for this one. That one's where you have the patient lay on the table, and then they have their arm off the side in a 90.
Mm-hmm.
You move them up into the position, and you have them try to hold it against gravity. And then if they start like weakening or it's painful, or if they're holding it, you can like try to put a little resistance against it and then see if it's painful. For that one, I had it positive in the external rotation.
Okay, I see.
That was the only other one that I would have had you try to do.
Okay, cool. I appreciate you letting me know that. It's just a little difficult for me to determine through the computer.
Oh, for sure. Yeah. Yeah. No worries. Trying to think if there's any other questions.
I mean, I can go ahead and make what I think my differential diagnosis is, and you could just tell me if I'm right or not, because I feel like I covered the bases that I wanted to.
Yeah.
So what I'm thinking is you have a rotator cuff tendinopathy or either like a strain or something like that, just because of the external rotation and the pain that you're having, along with like the onset and your deficits in range of motion.
Yeah. Yeah. Pretty much spot on. I guess specifically it was just like posterior rotator cuff strain.
I got you.
Yeah. So I was trying to gear it towards like infraspinatus mostly. And some teres minor, but I think I was focused a lot on infraspinatus. Um, let's see. Yeah, it's I mean, with telehealth, it's hard to like go through everything.
Oh, I
Um,
agree. Yes.
so I was gonna say like if you asked me about like some passive range of motion stuff um like with internal rotation at 90, like if you were to like push it through it, I was gonna say it hurts some at like end range of motion,
Oh, I
just
see.
because you would like be kind of stretching the infraspinatus a little bit.
Yeah.
So it might put some strain on the tendon. Um, but otherwise, yeah, you nailed it. So
Cool. Thank you.
yeah,
So I'm gonna pause the recording then. Okay.
okay, perfect.